And Fiona, there has been much criticism of what we call vaccine nationalism. And actually, the head of your organization, Tedros Ghebreyesus, as the head of the WHO, said the deals between some high-income countries and manufacturers of COVID-19 vaccines are undermining the WHO-led COVAX initiative. But the problem is, how can an international organization and national governments do about the inequitable distribution of vaccines? And what is their plan B?
So yes, so this was a major issue for us and still remains a major issue as we see the rich and wealthier countries use their buying power to actually, they used it previously to pre-order the vaccines before they were even out. But it's not the first time we're seeing it, because we also saw it with testing and therapeutics previously. But what can we do now? The COVAX facility was set in place to help low-income countries, low and middle-income countries, to be able to also equitably access these vaccines. And the African Union, what Dr. Ndembi referred to, has also come together to see that we can actually increase the pooled demand for vaccines to be able to support the poorer countries. But countries have also gone out to have their bilateral deals that they are doing with the manufacturers to access more vaccine. But also we've seen the G7, the meeting they had last week, as they called upon donations to poorer countries. We saw UK actually pledge to donate their extra surplus vaccines after they've vaccinated their population. We saw France also call for richer countries to donate at least 4 to 5% of their vaccines to poorer countries.
What are areas of improvement?
I think I'll take that first, if you allow that. So, yes, I think we are making remarkable progress on the continent, given the challenges that we did all mention. I think we have about 10 countries, if not more, that have actually really roll out a COVID-19 vaccine campaign. I think there was a very tremendous effort from WHO and partners to ensure that at least countries have their vaccine deployment plan. Very important. That's critical in ensuring that once the vaccine, safe, efficacious vaccine becomes available, we have a level of readiness. I think that's very important. I think we all appreciate that that is a substantial or remarkable effort at this stage of the pandemic. So now, you did mention also Ghana started, rolling out COVID-19 vaccines. So in the next coming days, there are about 20 other countries supported through the AVAT, the Africa Vaccine Acquisition Task Team, established by the African Union. That will also really roll out COVID-19 vaccines. So we're definitely going to be at least 50% of member states on the continent that have actually introduced COVID-19 vaccine. I think at this stage is really commendable. I think with support from other institutions like the European Union to support vaccine delivery on the continent, these are going to be really in the next coming days being really on a good path for as far as COVID-19 vaccine delivery.
Can I add a point here?
Yes, please go ahead.
Yeah, I think the wealthy country do have a moral obligation in terms of vaccine even distributions. Some countries stockpile a huge amount of vaccines, and considering that those vaccines only have limited lifespans, I think in the current situation, if you look at the African continent, the vaccination coverage is less than 1%. And if you look at the major European countries, actually the vaccination percentage coverage is 5 to 15 to nearly 20%. So some countries actually stockpile those vaccines. I think they can distribute through programs like the COVAX program. Actually, those vaccines could be quickly distributed to African countries. Those countries are in greater need. As the vaccine production capacity further expand, then those the new vaccines produced actually could supplement the current shortage. So I think this is in terms of if you look at the timeline, if you look look at the vaccine production and the supply. This is, I think, is one of the best strategy where we could achieve equitable distribution and utilization of the vaccines.
And Dr. Gao, there is another thing, that is how the Chinese vaccines can be available to much wider parts of the world. Because some people say China also vaccinating its own populace, and it's also sending its vaccines to other parts of the world. Is there a balance between vaccinating your own population and helping those people who are still very much severely affected by this pandemic?
The equitable distribution of the vaccine is very important. China joined the WHO for the COVAX. So I think we are happy to share with the whole world. That's the target. In China, we are talking about, we already have something like 50 million people vaccinated, some with one jet, some with the second injection already. Because in China, at the moment, we have 2 inactivated vaccines available for the conditional commercial use. And we also have one for the emergency use. I believe we will have a few more, at least a couple coming for the emergency use soon. So in that sense, China, we put the vaccination program like that. We put the key population. Those key population you can also call the critical population, who are working in the customs, in the hospitals, or some CDC workers, because they have the close contact with social people. And second, we would vaccinate the major group. That major group including someone with some special service. Someone like working in the kitchen, in the restaurant, something like that. So this is what we are doing at the moment. So that's our first target. So eventually, once we have enough vaccine, we will expand it more. And when you are talking about sharing, as I mentioned, China joined COVAX. We like to share with everybody. We also want to get the disease controlled. As I said, if we don't have all the countries safe, you cannot have one country safe. China cannot be safe without the whole world safe, because it's infectious diseases. We discussed for a long time. So China would like to assist with other countries to share. Of course, do remember, so we have a saying in English called charity starts at home. So we also make sure the professionals, they already been vaccinated, and then we will vaccinate others. And when you want to assist somebody else, you yourself must keep yourself safe. As you also read some news, even though in China we have already donated many doses of the vaccine to many, many countries. I think you will, from time to time, you will see some news there. Thank you.
So that's why this is a very complicated process and challenge, Fiona. Earlier, Sophie asked you, what is the priorities of COVAX? And where is the main challenge right now? Is it the sourcing of vaccines, the distribution, or which priority goods should first get the vaccine shots? What are the thinking in the WHO?
Thank you very much. And again, like Sophie mentioned, we are celebrating the first of the COVAX vaccines being delivered to Ghana, the first country globally outside the COVAX facility. So what are our priorities? Well, we have 192 COVAX facility participants. And what was agreed was that because we are talking of equity, each country is going to get at least 20% of their population covered within the first one by the end of 2021. But the countries have to meet some minimum criteria. Number one, the countries need to sign some indemnification and liability agreements. Their regulatory pathways must be very cleared, and they must put out their import licenses on top of making sure that they have a deployment plan and all that. Now, are we having issues with securing the doses? The issue is the COVAX facility will only give out vaccine that has been approved for emergency use listing by the World Health Organization. And so far we know that is Pfizer that received the EUL in December, approval for EUL, and we have the AstraZeneca that received that approval just last week. And we are seeing the first vaccine doses go out as soon as possible. But we have a number of vaccines. For example, the Sinovac from China is under active review now for approval for the emergency use listing. The Sinopharm vaccine is also has been included in the COVAX facilities basket, and we have 12 vaccines that as soon as they're out, we know that Johnson & Johnson too, we're expecting the review and approval very soon. So we really think, like Nikkei's mentioned, that we are on the way, and Africa will soon also get there.
So the supply will probably be coming on stronger and stronger. About vaccine reluctance, it happens in America. It also happens in Asia. What about Africa? Do the public have confidence in the vaccinate programs in general?
I think that they just let me put this in the context, and then with a couple of figures. So the African Union target is actually at vaccinating 60% of the African population, at least 35% by the end of 2021, and then the 25% next year. So we have secured about 270 million doses from at least 3 vaccines manufacturers: Pfizer, Johnson & Johnson, and AstraZeneca. Then what in line with that and in preparation to that rollout, what we conducted a continental survey on vaccine perception in 15 member states, and then about 15,000 respondents. I think a face-to-face interview here is more robust than probably online interviews. So it's quite interesting to know that 4 out of 5 respondents are willing to take a safe and efficacious vaccine when it becomes available. These are real-time data generated from 15 member states, and it ranges between 60% to 95%. And this is quite similar to other studies where we started looking at disaggregating our data. So we still have 1 out of 5 that are really have some kind of could be reluctant in really accepting vaccines. And we are also working in terms of risk communications and community engagement to ensure that we unpack the messaging for the 1 out of 5 so as to ensure that we have a successful rollout.
I have this question for Dr. Gao. Obviously, China has managed to bring this pandemic under control, although it also paid very high costs through concerted national efforts and local efforts. And most of the country now is basically infection-free. But how do you think the rest of the world, and especially Africa, should look at China's efforts and approaches? What can they take from what is happening here?
Well, as you said, the whole outbreak in China is well controlled at the moment. Of course, we have from time to time, we have very small waves, though, with every single waves, we got it down. So in China, we tried from the beginning with a very stringent containment strategy or measures in Wuhan. And after that, we have a few, almost 24 of the sporadic outbreaks for the last year. For that, we are introducing the so-called suppression strategy. That means whenever you have a sporadic cases or a small outbreak with local transmission, we will try to concentrate our effort, for the quarantine and for the isolation. We achieved for that. I don't think, because we have a very strong community level public health facility or capacity in China. So in many other countries, especially in Africa, maybe it's very difficult to pick up Chinese strategy because the very weak community level public health facility. So we are good at that. So in this case, I would think, vaccination will be the final target. We should try to institute vaccination. Like you mentioned from the very beginning, China is ready to share, to assist for the vaccination program, in Africa and in the whole world. I think we are pretty, in the whole world, we are at the moment, we are pretty in a very good position to introduce the vaccine because it takes time. Once you have the key population there, I think you'll be in the business.
Well, thank you so much for that comprehensive conversation with CGTN, as well as the SABC crew being led there by Sophie Mukwena, our foreign editor, and Noma Bolani also compiled and produced that particular segment. Thank you so much for choosing African Perspective this evening. With me, Aldrin Simpier. It is Stotsins, and goodbye. Enjoy the rest of your evening. Bye-bye from us and the rest of the team.